Hello and welcome to another Case of the Month session. Now today I have another very interesting case, and it's a 47-year-old female this time. And she has a history of antidepressant use for the last 15 years and a diagnosis of polycystic ovary syndrome. But other than that, her real problems have started like about 5 years ago, which was fatigue, backache and bone pain. Now, she'd been worked up for these previously in another center, and during the workup, what they discover is pancytopenia, an increased M spike and increased IgGs, and a bone marrow biopsy is performed, which is reported as a plasma cell dyscrasia with monotypic kappa monotypic plasma cells and a histiocytic infiltration. She is also biopsy. There's also a liver biopsy, which we'll get to in a minute. I'm not sure how that one was reported. Anyway, her parents being cousins, first-degree cousins, she's worked up for storage diseases, which is initially what they suggest the patient is investigated for, but no supporting evidence is found. And her symptoms gradually increase. They do not subside. So she eventually presents to our hospital. During the investigations in our hospital, again, we do find the monoclonal gammopathy, EMG is done, there's no polyneuropathy, and all sorts of radiological examinations are done where the hepatosplenomegaly is still there. We see that one of her kidneys is atrophic, the other also has scars on it. And most prominently, what they see is increased density, soft tissue density in the retroperitoneal area, the mesentery, the peritoneal thickening of the peritoneal surfaces, and also increased perirenal density. And the brain MR reveals findings that are consistent with extramedullary hematopoiesis along the falx cerebri. So I'm going to show you the patient was biopsied from that perirenal mass at our hospital, and also the previous bone marrow and liver biopsies were brought to our hospital for consultation. And this is the bone marrow biopsy that was previously done. And here you can see that the bone marrow space is infiltrated with maybe a very pale infiltrate. Let's say I'm going to move and zoom in, and you're going to be able to see them better. And there are patchy areas of here, hematopoiesis that's left, but only patchy. And let me just zoom in. When you zoom in, you can actually make out that these are histiocytes. See, they've got really pale cytoplasms. And it does look like the cytoplasm is stuffed with something. Over here, you can see that there's like granular, sometimes globules with angulated contours in them. And I'm going to highlight these with special histostains. But some of them were like larger and like slightly angulated even from here. These, and see over here like this. And there are these bigger globules as well. See over here like so. Okay, so it does feel like there's something granular within them. Other than that, see, here's the area of hematopoiesis, that patchy area that I was talking to you about. And you can also see a few plasma cells, see, in between, like over here and here and here and here, amongst these histiocytes. Now here is the CD138 stain, which shows us that there's actually quite a lot of plasma cells within amongst those histiocytes, much more than we could actually discern at H&E level. Here they are. There's quite a lot of, and over here they're like sheets of plasma cells, accompanying plasma cells. And when you look at the kappa lambda stains, you can see that the really dark staining ones are the plasmas, okay? So you can see that these plasma cells, I'm going to zoom into the histiocytes in a minute, but they're all So you can see this is the kappa stain. Now I'll show you the lambda as well. That the plasma cells are positive for kappa. Okay, this is the lambda stain. And when you zoom in to the kappa stain, you can also see, even without zooming in, that the histiocytic background is also positive with kappa. And in fact, although we don't have electron microscopy, but it does seem that those granular stuff within the cytoplasm of the histiocytes, they're also kappa positive. With the trichrome stain, easier to make out these. Some of them are smaller, granular, but some of them these are larger, angulated, crystalloid structures within the cytoplasm of the the histiocytes. Over here, you can see them as again. Some of them are like rhomboid shaped, some of them are more angulated, some of them are like rod shaped, but you can see these larger and probably much tinier crystals. So what we diagnosed this biopsy with was multiple myeloma and accompanying crystal storing histiocytosis. And in fact, the perirenal biopsy, the mass from the perirenal mass, the biopsy from the perirenal mass, was also similar in that it showed again a histiocytic infiltration. The whole biopsy sample is composed of histiocytes. And these histiocytes again seem to have a granular cytoplasm, which again most histiocytes can have. With the trichrome stain, when you zoom in, that they're crystalloid structures within the cytoplasm of the histiocytes. They're like different shapes and sizes. See, they're better visualized when you move the micrometer. They're really smaller, tinier ones, and that there are larger ones, but they're definitely there. So that mass is also crystal storing histiocytosis. And again, with the kappa lambda stain, you can see that the crystals inside are paraproteins. See, this is the kappa stain. Move on to the lambda stain. Are not staining. So what we suggested was that this is probably crystal storing histiocytosis due to the underlying monoclonal gammopathy, and is actually part of the symptomatology of the multiple myeloma present in the patient. And this is the liver biopsy sample. And when you look at the liver biopsy, again, what you can see is you can see that the Kupffer cells are really large over here. See, let me just, they're like hypertrophied and vacuolated. In fact, they're like filling in the sinusoids as well. They're like plugging them. Here they are. See, they're all, and then in some of them again, you can like make out these crystalloid structures, but I wasn't sure if I could actually say so with this. I'm going to show you the CD68 stain as well. What draws what point that draws attention is that there's extramedullary hematopoiesis here as well. So you can see the megakaryocytes and the erythroid islands over here filling the sinusoids, in addition to the hypertrophied Kupffer cells. Here's another megakaryocyte. Here's another Kupffer cell. And with the CD68 stain, I felt like, not only with the H&E stain, I felt like some of these histiocytes, again, within their cytoplasm, there were like these, again, maybe spicular or rod-shaped granularities within them, and that maybe these are also engulfing the paraproteins that are in the peripheral circulation of the patient. But this is too difficult to say without electron microscopic evaluation, but I just suggested that this might also be the case for the Kupffer cell hyperplasia, that might be a result of the paraprotein in the systemic circulation. So I hope you enjoyed this case of crystal storing histiocytosis due to paraproteins of multiple myeloma. Oh, and almost forgot. There was also a cytology specimen biopsy sample taken from that perirenal mass, and it wasn't a very good sample at all. As you can see, it's really devoid of cells. It's really paucicellular. But when you do zoom in to the one or two cells that are actually present there, you can see that these are probably our crystal storing histiocytes. You can actually see that the cytoplasm is filled with stuff that we might even think are bacilli. They're like needle-shaped structures. Those are even more dust-like maybe, but still, you can still see that they're like needle-shaped crystals within the cytoplasm. They've got different shapes. Some of them, as you can see here, are more globular, maybe rhomboid shaped, or like maybe rod shaped. This resembles a rod, and some of them are more globular, but they are in there. But of course it's very difficult. I'm looking at this specimen with an oil immersion. It's very difficult to actually recognize this, especially from a sample like this one. And it was even worse with the pap stain. They're like negative images, only vacuoles, crystalloid vacuoles within the cytoplasm. So, hope you enjoyed this case, and see you next time. Bye bye.